Hello, I'm Julie, the Learning Disabilities Nurse at the Willow Group. Having a vaccination is the most important thing we can do to protect ourselves against ill health. They prevent up to 3 million deaths worldwide every year. If people stop having vaccines, it's possible for infectious diseases to quickly spread again. Vaccines teach your immune system how to create antibodies that protect you from diseases. It's much safer for your immune system to learn this through vaccination rather than by catching the diseases. Once your immune system knows how to fight a disease, it can often protect you for many years. All vaccines are thoroughly tested to make sure that they will not harm you. It often takes years for a vaccine to make it through the trials and tests it needs to pass for approval. Once a vaccine is being used in the UK, its safety continues to be monitored. Most vaccinations only take a minute and are carried out by a nurse or other healthcare professional. When you go to the medical centre or GP practice, let the receptionist know that you have arrived for the vaccination. You may be directed to a waiting area or a queue. Wait to be called in to the vaccination room by a member of staff. If the waiting area is too busy or noisy for you, you can ask to wait somewhere quiet. The vaccination room will usually look like a normal doctor's room, with medical equipment, a bed and chairs. The person who is going to do your vaccination will ask you if you have any allergies. A vaccination normally involves injecting a small needle into your arm and will only take a couple of seconds. You can bring somebody with you for support. If you don't like needles, tell the person who is giving you the vaccine so they can make sure you are more comfortable. Depending on what you are wearing, you may need to take off your jacket and roll up your sleeve. Before the injection, they may advise you to take a deep breath and hold it for 3 seconds. This will help you to relax. You can also close your eyes or look away when having the injection. To take your mind off having the injection, you can talk to the nurse or the person you have gone in with. You can even sing if it helps you to feel more relaxed. You need to relax your arm. You might feel a slight pricking or scratching sensation when the needle goes in, but it shouldn't be painful. You can leave the room as soon as the vaccination is done, and you can sit down in the waiting area afterwards if you feel lightheaded. You can ask for a drink of water if you need one. If you are nervous, you can book a double appointment with an experienced nurse so that you can spend longer in the appointment and have extra reassurance. Most of the side effects of vaccinations are mild and do not last long. The most common side effect of vaccination is the area where the needle goes in looking red, swollen, or feeling a bit sore for 2 to 3 days. Usually, your GP surgery will offer you certain types of vaccinations depending what you need. You may have to ask for vaccinations if you are travelling to a country that requires them. These may cost you money, but other vaccinations are free of charge. If you think you need a vaccination but you haven't been invited for one, you can ask your GP surgery. You will usually be given a specific time to come and get your vaccination. If you are 50 years or older, you should have a flu vaccine every year. You may also need a flu vaccine if you have certain health conditions, are pregnant, are in a long-stay residential care, or live with or care for someone who is vulnerable to flu. You can book a flu vaccine online. Almost all vaccinations require an injection. You may be able to ask for numbing cream to use where the injection will go in. You can also request to have a flu vaccination delivered nasally. This is a spray that goes up inside your nostril. There may be other types of vaccines, such as pneumonia for people aged 65 and over, and shingles for people aged 70 and over. Other types of vaccines may also be offered for conditions including whooping cough, hepatitis and meningitis. Speak to your GP surgery if you think you have missed any vaccinations. They can book or rearrange the next available appointment. It's best to have vaccines on time, but you can still catch up on most vaccines if you have missed them. There are very few people who cannot have vaccines. Generally, vaccines are only not suitable for people who have had a serious allergic reaction to the previous one, or ingredients in the vaccine such as eggs. People with weakened immune systems, for example because of chemotherapy treatment for cancer or a health condition, may also not be able to have some vaccines. If you're not sure if you can be vaccinated, check with your GP, nurse, health visitor or pharmacist. Thank you for watching. We hope you will now feel more confident going to the medical centre to get a vaccination. If you have any questions, you can contact your GP practice for more support.